The vast majority of surgeries for torn ACLs of the knee are reconstructions, meaning making a new ACL either with tissue from your knee or from a donor. Which of the different graft options is best? I share my thoughts and what the data shows in this video. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. This video is part of my Ask the Doctor video series based on questions you've left me in the comments to the videos on this channel. Also, please know in these videos, I am not giving specific medical advice. This is meant for general information and educational purposes only. The question this week, very simple. Which graft is best for ACL surgery? Now, first of all, when we're talking about a torn anterior cruciate ligament, generally we're talking about reconstructions, making a new ligament. Yes, there are some fairly new procedures that are basically ACL repairs where they try to sew it back together and they bridge it together with suture and some other tissue to try to augment that repair to try to avoid a full reconstruction, potentially for a quicker recovery. I'm not talking about that in this video. I'm talking about the traditional ACL reconstruction. There's two categories of grafts when you're talking about ACL reconstruction. There's the autograft, tissue from your knee, and the options in the autograft world are the middle part of your patella tendon, hamstring tendon, or quad tendon. They're basically taking tissue from one area, moving it to another to make a new ACL. I'll talk about that in a second. Then there's allograft, which is tissue from a donor or a cadaver graft. I've done a number of videos on my channel about this, so I'll only mention it briefly here, but I am not a fan of allograft except in very unusual, maybe revision situations. Much higher failure rate, especially in young people, athletes. I would never recommend an allograft. Personally, I know that there are a lot of people that do them, but I think the failure rate is just not worth it for a little bit less pain at the end of surgery in the recovery. I think the failure rate, the risk of re-rupture is just too high. So if we're focusing on the autografts, again, the patella tendon, hamstring, quad tendon, they all have their pros and cons. And the cons are related to you're basically taking tissue from that area. There's a lot of surgeon preference, and then some of that's a little bit based on factors about you. So for very, very young patients, before they're done growing, they typically do hamstring tendons rather than ones that involve taking a piece of bone. For a variety of reasons, but hamstring might be better there. Also, jumping athletes, if you're somebody like volleyball, basketball that jumps a lot, some surgeons prefer hamstring over patella tendon because, again, patella tendon is used so much in jumping athletes. Also, if you're a person like a carpenter who kneels a lot and will put pressure right where that middle part of the patella tendon was, there are some people that think, all right, maybe patella tendon is not necessarily great for them. So there are some patient-specific factors that might play a role. So it's definitely a good idea to talk to your doctor about that. Also, some surgeons have a preference and they're very good at one versus another. And if you want a particular surgeon, you very well may go with what that surgeon prefers. As far as outcomes, they're all generally about the same. Some individual studies show maybe one better than another, patella tendon better than hamstring, but overall these large studies show that generally they're fairly equivalent. There are other factors that play a large role in outcomes as well. Physical therapy and the recovery and how well the recovery goes, other injuries, other ligaments or meniscus that may negatively impact the outcomes, cartilage damage, a number of things like that. So all of those potentially play a role. Again, I would talk to your surgeon, especially about those patient-specific factors. If you're a jumping athlete or if you kneel a lot or your age, things like that, that may play a role. But I generally think, and the data generally shows, most of those autograft from your knee, most of those tissue options are good as far as ACL reconstruction. Now, if you want to know about a variety of non-surgical treatments for orthopedic injuries, even though it's called the Arthritis Solution, I have an ebook that talks about a number of non-surgical treatment options for a variety of orthopedic injuries. You can get it free by clicking the link in the description below this video. If you have an orthopedic injury and you want to hear about other options other than surgery, other than cortisone shots, you can click the link in the description under this video. fill out the contact form and learn more about scheduling an appointment to see me. Also, I'd love to hear your experience with your injury. Leave those in the comments below this video. Just understand, if you leave a question for me in the comments, I can't offer you medical advice, but I might answer your question in a future video. Make sure to subscribe to this channel, click the bell to be notified when I release a new video and when I start my Ask Dr. Geier live shows. Thanks for watching, and I look forward to helping you feel, look, and perform better than ever.